Hello?
Is that Paul?
Yes, speaking.
Hi, this is Saib. I'm one of the hair loss specialists calling from the Belgravia Centre.
Hiya.
How are you doing?
Yeah, not too bad, thank you.
Good stuff. I heard you just had a few questions and queries about the medications.
Yeah, that was right, yeah.
Okay, so, in terms of, is it yourself that's experiencing hair thinning or hair
It
loss?
is, yeah.
Yeah. And, have you seen anybody, do you know what type of hair loss it is, or what particular area is thinning?
It's just generalised thinning, really.
And for how long has it been thinning for?
Probably about a year or so now.
About a year, okay. And is there any area in particular, like is it more receding lines at the front of the head, or is it
No, it's just generalised thinning all over. I don't have any like bald patches or anything, no.
Yeah, okay. So, are you in the London area at all?
No, I'm in Hull, which is obviously in Yorkshire.
Yeah, okay. So, I mean, in terms of the medications that we use, we generally, depending on, there's a few different kind of factors and what medications we choose. It depends on the rate of hair thinning. If it's something like male pattern hair loss, which is, the most common hair loss in men, sitting at the top of the head and the back and sides left alone, and that's a genetic type of hair thinning or hair loss. Depending on a few factors, we would generally prescribe Propecia tablets and a minoxidil, depending on the strength that's needed. In some cases, if men don't want to take Propecia, we use 2 minoxidils instead in a higher combination. So it's not always the case that you have to take Propecia, or that without Propecia the treatment is, redundant at all. But we would generally prescribe that first, and then depending on, some men don't want to take the Propecia tablet, and that's fine. They just use 2 minoxidils as the alternative.
Right. What's the risks and benefits of both then?
With Propecia, the possible side effects are things like lower libido, testicular pain, impotence, and tenderness on nipples. They're the possible side effects with Propecia. It's less than 2% a chance of developing the side effects. So they are the possible side effects. With Propecia, it does generally work a little bit more effectively than just the minoxidil do. It's not always the case. It does depend on what stage of male pattern the person is in, or the man who takes Propecia, because obviously if it's a relatively early stage, then the minoxidil can just do the same thing. But the tablet, anything that comes in a tablet form, works systematically, so it does generally work a little bit faster and sometimes a little bit quicker. With the minoxidils, all of the minoxidils that we use, so minoxidil is predominantly used to regrow the hair. So that's why we would usually use Propecia as a DHC blocker that stops any more hair from thinning. Then the minoxidil used in conjunction with it is what helps to regrow the hair.
Right.
However, you can just use 2 separate minoxidils, because all of the minoxidils that we use contain a DHC blocker with them. So, for example, if you're using 5% minoxidil in the morning and a 10% minoxidil in the evening, the 5% has medroxyprogesterone or azelaic acid, that's the DHC blocker in that one, and the cream has azelaic acid. So they both have DHC blockers on it. So they both topically can stop hair thinning and regrow the hair as well. But obviously the tablet, the Propecia tablet, does generally work a little faster.
Right.
That would be the only main difference.
Like when you touched on the side effects, I mean, you said there was like 2% or less. I mean, when we're talking like side effects, I take it, if I was to experience any problems, would they disappear? Do they go away, or what?
Yeah, we'd recommend, so the actual medical leaflet that comes with Propecia have stated the possible side effects, and they would recommend that you keep taking the tablets if you were experiencing side effects. That's what they've printed on the medical leaflet. However, our recommendation would be, if you were in the 2% to have side effects, that you stop taking the tablet, and the side effects should wear off after that. They have also, they have stated on the medical leaflet that persistent side effects is a possible side effect, and that's in that 2%. But Having said that, they do also, just beneath that, recommend that you keep taking the tablets if you are having side effects. So they obviously have had enough research to back up that if you continue taking the side effects, if you continue taking the tablet, the side effects should wear off. So
is there any sort of permanency to the side effects then?
Not that they've stated, but they have said that persistent side effects could potentially be a possible side effect. So they have that stated as a possible side effect, that the side effects could be persistent. It doesn't say anything about permanent, but it says persistent.
Right. What's the difference? I don't even know. What's the difference between persistent and
is that it could reoccur again. That you could have the side effects. So let's say if it was testicular pain, that you could possibly have testicular pain again, stopping the tablet. Permanent side effects means that you obviously, it's consistent testicular pain that wouldn't necessarily go away, or that, that would be continuous. So they don't say permanent side effects. They just say persistent. Right.
Okay. I mean, what's your experience been? Have you had any ill reports from Propecia or anything?
I have had patients who have had side effects from Propecia and they've stopped taking the medication. However, with Propecia there is quite a big placebo effect, meaning that a lot of men who hear about the possible side effects, feel as though they get the side effects, because they worry so much about having the side effects. Because in research, they obviously, like any medication, they give one group of people the actual medication, and then they give another the placebo. So with the Propecia trials, almost 60 to 70% of the placebo group came back to say they had side effects, even though they didn't actually take Propecia.
Right, because I think one of my biggest concerns was I was just searching the internet today, and there's a lot
of stuff on the internet about Propecia.
Well, it was actually a link actually on your I think your Belgravia YouTube. You've got like a YouTube account.
Channel,
yeah. Yeah, YouTube channel, and somebody had posted a link in response to that where I think it was somebody stating that they'd had a conversation with I assume one of your colleagues, and they'd said that that Propecia could cause permanent impotence.
Well, the impotence is a possible side effect, but on the medical leaflet that comes with Propecia, it does say possible side effects, but there hasn't been anything to say that it could cause permanent impotence.
So you're saying it doesn't cause permanent impotence?
No, it shouldn't, unless if there was an underlying problem. So with Propecia, we're very selective about what men we would give it to. So if men have had any problems like prostate-wise, if they ever had anything like low libido, erectile dysfunction or anything like that before, we wouldn't give them Propecia, whereas a lot of GPs will give Propecia to men. Or if men have had any background of depression, or if they were taking antibiotics, antidepressants, we wouldn't give them Propecia either.
So if you're healthy with no previous sort of health problems, then Propecia would probably be all right to use.
Yeah.
Right.
But like I said, it's not necessarily a prerequisite. So if you didn't want to take Propecia, you can just use the 2 minoxidils. So some men, like I said, they just don't want to take Propecia at all, and that's absolutely fine. They just use the 2 minoxidils, and it works just as
well.
Yeah.
All right, I appreciate that. Thanks for your time. Anyway, what was your name? Sorry.
Saive.
It's what? Sorry.
Saive. S-A-I-V-E.
S-A-I-V-E. Right. Thanks ever so much for your time, and I'll consider which is probably going to be my best course of action then.
Yeah, no problem.
All right. Thank you.
If you want, you can complete the online diagnostic form on the website, because obviously if you're not based in London, if you wouldn't be able to come for a free consultation, you can do that one, and we get all the information from that as well.
All right, no problem. Thanks ever so much for your time. Cheers.
No worries.
Bye.
Have a nice evening.
Bye.
Bye-bye.